Respiratory therapy, Alvin speaking. No, I didn't. Oh, okay. Alrighty. Alright, bye. Sorry. Duty calls. I'm Alvin Ines. I'm one of the respiratory care practitioners at Garfield Medical Center in Monterey Park, California. As a respiratory care practitioner, we are involved in anything related to the heart and the lungs. So anything with patients that go into respiratory failure or heart failure or full arrest or anything like that. On an hourly basis, we actually go ahead and attend to each patient. We actually go ahead and assess the patient, make sure they're comfortable, make sure they're doing okay. We take a look at their vital signs, make sure everything's within the normal ranges. And as far as patients that are actually on mechanical ventilation, we make sure that they're actually ventilating well. Depending on the situation, we either put on a PAPR or we also just use our particulate mask. With patients that we don't have to intubate, patients that are not being on a mechanical ventilator, we actually take the precaution of putting on our mask, our P100 mask or N95 mask alongside any safety goggles or shields to avoid any kind of bodily fluids exchange through your eyes, nose, or mouth. We also put on a Buffet cap, which is a hairnet, and also a gown to go ahead and make sure that there's no exchange from patient to employee or patient to therapist. Being prone is a specific procedure. It's something that we actually do with patients that might be acquiring ARDS, which is in relation to the virus alongside any respiratory conditions. So with a patient that's in a prone position, we are there to help aid by making sure the patient has a patent airway and also making the patient comfortable as possible on the mechanical ventilator. With proning, the success rate is very high. It's actually a positive outcome. When the pandemic hit and also with our patients, the flow of patients coming in, it was overwhelming, but our hospital was able to gather up as many personnel and equipment we can to succeed. Personal protective equipment was actually on such a demand. We were such a low at one point, but with the community that actually was able to donate whatever they can donate to help our hospital out was such a big help. We've been given masks, gowns, shoe covers, anything that we could possibly do to cover ourselves and help aid to our patients was actually help donated by our community. As a first responder and as a respiratory care practitioner that's involved in this pandemic of the COVID-19, I highly advise everyone to be safe, wear a mask, take the precautions possible to wash your hands, try not to be in a big gathering, and just stay indoors.